My name is Matthias von Schwanenflügel. I'm a German lawyer. I used to work at the Ministry of Health. Now I'm working in the Ministry of Family Affairs, Senior Citizens, Women and Youth. And I'm the head of the Directorate-General, Demographic Change, Elderly People and Welfare State.
And how would you explain what you do to a lay person?
I'm a civil servant. We work on different laws and we try to improve the situation of elderly people. We try to improve the situation of people in need of long-term care by elaborating projects and by working on different laws.
What would you say are currently the three main policy priorities for long-term care in Germany?
The critical situation we're having in Germany is the shortage of workforce in the field of long-term care, and that's extremely that's a very, very difficult situation because we have to attract young people to work in the field of long-term care, professionally working in the field of long-term care, and we have to have families to care for their elderly and to care for their relatives in need of long-term care, because as we do not have enough people in the workforce, somebody has to care for the elderly, somebody has to care for the people in need of long-term care, and this goes to the families, because the people live together with their families and they have to, well, in the end they have to care for them. So we have to support them, and at the same time we have to make sure that we have enough professionals in the field of long-term care. Another priority is how we connect and how we connect the long-term care scheme together with the local communities. So we have, on the one hand side, we have in Germany we have the long-term care scheme, which is not run by local communities. It's run by the long-term care schemes, the institutions of the long-term care system. That's one thing. The other thing is we have the local communities who have to care for their elderly, who have to care for their families, and who have to care for their kids. So we have to bring them together, to work together, and that's not easy often.
To what extent do you think that these priorities have changed in the last 5 years, if at all?
I think, well, the last priority, the working together of the institutions, that hasn't changed. We try to improve it, and it's still on the agenda. But the other topic, shortage of workforce, that has become more dramatic.
If you had the opportunity to introduce one new long-term care policy in Germany, what would it be and why?
Well, a new project or a new instrument to get more people in the field of long-term care, working in the field of long-term care professionally.
In terms of research priorities, what do you think is an outstanding piece of research on long-term care that needs to be carried out in Germany?
Well, I'm not a researcher, but we have to improve the instruments to get the people work in the field of long-term care professionally, and we need some research on the situations of families, helping their elderly, helping their family members and who need long-term care.
So now I'm going to ask you a few quick questions. I'm looking for a number in response from 1 to 10, where 1 is low and 10 is high. Firstly, what policy priority is allocated to long-term care in your country?
I would say 6 or 7.
How aware is the general public in your country of what the long-term care system offers to them?
Well, that's a tricky question. I would say perhaps 5, 4 or 5, and we have to improve the situation. We have to improve the situation that people know what help they can get from the long-term care system, and that has to become better.
And how well does the system support people with long-term care needs?
Between 6 and 7. Oh, well, it depends. If you look at other countries, I think the German system isn't too bad. But if you just look at the German system, then I would say perhaps 6 or 7.
And how well does the system support the needs of carers?
Well, that's a tricky question again. I would say 4 or 5. I think we have to improve the wages in some institutions, and we have to improve the wages. And as we do not have enough people in the institutions and in the outpatient sector, the ones who do their job, they do the job for other people as well. So they are in a really stressful situation, and I think we do not meet their needs. We have to improve the situation so that we get more people working as nurses, if you know what I mean.
So formal carers, yeah.
Right.
And how integrated are social care and healthcare services in Germany?
I would say 4, between 4 and 5. Well, as I said, we do need some research, and I like the ILPN network because you can exchange ideas from other countries like the UK or the US or Japan, and so I like the network, and it helps sometimes. And we had 2 years ago, we had a really good discussion on family caregiving, so that helped me a lot.
Thank you very much.
Okay.